Imagine a world where heart disease doesn't dictate your life. A world where you can enjoy every moment free from the fear of a heart attack. Today, medical advancements are making this a reality. Introducing Transcatheter Aortic Valve Replacement, also known as TVAR. Let's dive in with our expert.
So what is CHIP angioplasty? CHIP stands for Complex High Risk Indicated Angioplasty. What is definition of a complex angioplasty? An angioplasty involving the left main, an angioplasty which has a bifurcation or it's a wide limb, an angioplasty where there is a lot of calcified blockage, and an angioplasty where patient's heart ejection fraction is less or the heart is weak and the pumping efficiency is very low. And the second one is indicated. Some of these patients would have these type of blockages, but angioplasty would not be indicated. But there are a lot of patients who would have these higher risk blockages and angioplasty is indicated in them. And P stands for PCI or a percutaneous intervention. Now let me discuss with you about a calcified blockage. Calcification in a blockage is one of the most important indications, or let's say one of the most common reasons for a bypass referral. And the reason is when there is a calcified blockage inside the artery, it prevents the advancement of stent. Number one, it prevents the full expansion of the stent. And number three, even as the stent is deployed and the stent is not fully expanded, these stents come with restenosis very soon. How do we remove calcium from a blockage? We publish our own data of 400 rotablator cases at EuroPCRs, which is one of the largest conferences in interventional cardiology held in Paris. Rotablator or rota angioplasty refers to using a rotational atherectomy, which is a drilling device made of a diamond which rotates at a speed of 1,60,000 revolutions per minute, and we would go ahead and ablate the calcium from inside the lumen of the vessel. When the calcium is removed, the stents can advance safely, but most importantly, the stents are expanded to the full diameter. When the stent is expanded to the full diameter, the restenosis rate, the stent thrombosis rate, requirement of a repeat angioplasty is far less. Rota angioplasty is done with standard technique to make it safe. We have published our own paper on doing a safe rotational atherectomy, and we do this for a lot of calcified blockages involving the main arteries as well. Now sometimes when patient's heart efficiency is less and the rotational atherectomy or an advanced angioplasty is required, we use the smallest artificial heart pump, which is called Impella. Now Impella is a device which we insert from the groin vessel. It provides a cardiac output of 4.5 liters and allows us to complete the angioplasty safe and protects the patient during the angioplasty procedure from an untoward incident. One common thing which comes to everybody's mind is, can we do angioplasty where there is another branch which takes off? Is there a chance that when we put a stent, the side branch will close off? This is called as bifurcation angioplasty, which we have routinely been doing, and we have mastered the technique of doing a bifurcation angioplasty where we put a stent and also protect the side branch. Similar bifurcation also involves left main artery. Left main angioplasty is very crucial because left main supplies the entire heart. If anything goes wrong in that angioplasty, the patients can have adverse outcomes. The left main angioplasty is done by imaging guidance, which is intravascular ultrasound or OCT, where we would put a stent, do an imaging and make sure our stent is in the right place. All these things encompass CHIP, which stands for Complex High Risk Indicated Interventions or coronary angioplasty. In my own experience, doing these CHIP cases safely have actually helped our patients who had no other way of hope.